I'm glad you're touching on the topic of pain management, because that is the better part of the courses that you're going to be giving here in Cape Town and in Johannesburg next weekend. And your work in the hospice obviously brought you in touch with people who are terminal ill, and you're going to be talking on that too during the course?
Yes, I will, because I believe that there is a great market all over the world for hypnotherapy to join hands and build credible bridges, not as alternative but as complementary health care with terminal patients. As part of the comfort therapy program, our job was to enhance the quality of living for what life these people had left. So I would actually describe a number of different hypnotic pain reduction techniques to each patient that I worked with, and then let the patient choose which ones he or she wished to use. I always did a peaceful place meditation where I would help teach self-hypnotic techniques to the patient so that he or she could use self-hypnosis to imagine being comfortable in a peaceful place, and then from there expand on whatever specific type of pain management imagery would be more helpful to that patient. But I want to interject right at this point a caution that unless you are working with someone with his or her physician's consent, pain is a warning something's wrong with the body. And you don't want to go just jumping in and doing pain management reduction hypnosis with a client unless that client has consent from his or her examining physician. Because, for example, while my headaches were caused by stress and a certain part of my subconscious over a period of decades causing me some self-punishment for not being perfect, what if the cause of the headache is a tumor or internal hemorrhaging?
Correct, yeah.
So Charles Tebbets taught us back in 1983, pain is a warning something's wrong with the body, and you need to get the cause of the pain checked out first. So the alternative healthcare practitioner might sometimes go in where angels fear to tread, whereas as a complementary practitioner, my job is to help the client in conjunction with his or her examining physician. So a recent example last year was a lady who saw me for being overweight, but she also had cancer and was facing some surgery that she was really scared of. And when she asked me if I could use hypnosis to help her deal with the cancer, and I gave her what I call my medical disclosure, she comes in a week later with a little RX slip from her doctor. It says, hypnosis okay for her cancer, with the doctor's scribble on it. And then I used a variation of parts therapy where I called out that part of her most closely connected with her perception of God or higher power. And her higher power part told her that she needed to practice the peaceful place meditation in order to be calm before her surgery, because her surgery would go better if she was at peace rather than stressing.
Yes, absolutely.
So that helped her both before the surgery and in the recovery after the surgery, by being able to use self-hypnosis and meditate in her peaceful place.
This leads beautifully into the next question that I wanted to ask you, especially when we talk about terminal ill people. There is obviously a spiritual aspect to that. It could be that karmically or spiritually people have a contract that the time is over, that they have to pass on and do their things. So is it always right to come from a point of view to prolong the stay on the planet, or even so it's heartbreaking for the loved ones and for the person themselves often? But how does the spiritual aspect fit into hypnosis practices for you?
Boy, in answer to that question, something jumps right into my mind involving one of the patients I worked with through the Franciscan hospice, who was in her 30s. She looked older than her mother, who was in her 50s. And in the very last session I did with this lady, she asked me if I would use regression therapy to help her heal from her stormy relationship as a rebellious teenager. And at her request, her mother sat in on a session. And I won't describe the details of the session because I don't have the time to do that, but I will say that when the session was over, her mother wanted to talk to me in her living room for a few minutes, and her mother said that as much as she wished her daughter could have been healed physically, she said it means more to me that her soul was healed because I can now release her to the other side and be at peace. And I was so touched by the depth of that mother's love that I cried all the way home that night. It was a 30-minute drive, and I think I shed quite a few tears. That was the last time I saw her daughter.
Yeah. My personal opinion is that self-hypnosis or guided hypnosis or imagery or visualizations really can either open, reconnect, or strengthen whatever we perceive as a spiritual connection. Do you share that opinion?
Yes.
That was a short answer.